It's time to get our weekly coronavirus update from Dr. Zorba Paster.
He joins us now to discuss the many headlines about the virus, and later he'll be taking your calls. We'll let you know when to call in. Hi, Zorba.
Hi, Zorba. Good to see you.
Good to see you guys.
We still should be wearing masks out in public, right?
Yes, and I've got to get an example. These are masks that I bought on Amazon. You've heard of Amazon, right?
Yeah, I think so.
But the nice thing about these are you put them on, and they're fun. And if you have something that's fun, you're much more likely to wear it. And that's sort of part of what it is. Wearing masks is still one of the best things we can do. Social distancing, of course, is really important, but wearing masks is very important because it'll keep from spreading it to others. Still an important thing.
Well, we just reached a grim milestone in this country of 100,000 deaths from the virus, so we're not out of the woods yet.
Right. We are by no means out of the woods. Social distancing, making sure you're 6 feet apart, really makes a difference. The other thing that really came up this week was the fact that hydroxychloroquine has been shown not to work and actually have side effects. The side effects are sudden death from a cardiac rhythm disturbance. So even though there are several other studies that are going on with hydroxychloroquine, basically it has not been shown to do anything. Anyone who is on it should seriously consider going off of it because right now the recommendations are it's really not doing what we think it should do.
There's no preventative medicine at this point anywhere.
There is no preventative medicine. Now, one of the other things we have found out is basically we thought that the death rate would be about 2 or 3% of those people who actually ended up getting COVID. And it turns out the death rate is lower. It's only 1%. But that is still 10 times the death rate that we get from influenza. So it's still very, very important to know that we don't want to get it, and that means social distancing if you have it, getting checked if you're worried about it, and staying self-quarantined until we really know exactly how to treat this.
Okay, now's the time to call in at 270-9933. Zorba will take your calls. We noticed the number of cases in Wisconsin going up, but that's maybe because we're testing more.
I think that's part of it. Part of it is sampling. That's exactly it. And part of it is the fact that it reminds us we're not out of the woods. And even though we want to get together with friends and family, staying 6 feet apart is still the safest thing to do. And we do that with our son, our daughter-in-law, and our grandchild. We just make sure that we're actually 6 feet apart outdoors, less likely to spread it than when you're indoors.
Okay. Slowly but surely. 270-9933, the number to call. We'll get to your calls right after the break.